Hi, this is Dr. Sushant. I'm an orthopedic surgeon with special interests in arthroscopy and sports medicine. Today we're going to discuss a few things about sports injuries and ligament injuries around the knee, commonly among youngsters and mid-aged people. Now, what is the most common ligament injuries we have? The knee is usually susceptible for ligament and meniscal injuries, commonly happening due to RTAs, road traffic accidents, especially two-wheeler accidents, and during falls from steps or falls while running in any kind of sports, and among youngsters playing football, cricket, volleyball, and so on. What are the most common injuries which occur? Most commonly, we usually injure one of our main ligaments in the knee, that is the anterior cruciate ligament, followed by the posterior cruciate ligament. And we have structures which is, I'll just show you. Well, this is the knee joint and this is how we walk, right? And then the anterior cruciate ligament is this. This is a ligament joining from your thigh bone femur to your leg bone tibia. So this acts like a stabilizer of the knee. In a sense, it prevents the forward slipping of your knee joint. So that becomes a very important stabilizing structure of the knee. For example, when you're running down the stairs or running on the field while playing football, if you had to suddenly stop, then this ligament would stop the body from slipping forward. If you didn't have the ligament, you would just buckle. The knee would buckle and you would fall down. So ACL is one of the very important ligaments in your knee, the stabilizer of the knee, and it commonly is injured during twisting injuries while playing football or any other kind of sports, or during a road traffic accident, especially two-wheeler accidents. And then accompanied with that, we also oftenly injure our collateral ligaments, that is your medial collateral ligament, the inner side, and the lateral collateral ligament, the outer side. And we also injure these blue structures you see is called as a meniscus. They act like the shock absorbers in the knee, and on them we have a smooth movement of the knee. So when you tear these meniscus during rotational injuries and twisting injuries, they cause episodes like locking, which commonly happens post-twisting injuries, that you happen to have locking of the knee. So that's when you tear the meniscus, which can tear in different forms: vertical tears, horizontal tears, radial tears, right? So what do we do? Now, how does arthroscopy help? Now, early intervention of such problems, which can be diagnosed by an orthopedic surgeon by clinical examination and confirmed by an MRI. And then later we get inside the knee with a procedure called an arthroscopy, which is a daycare procedure, very minimal invasive, very small incisions, where when we insert a broad lens camera into your knee and we have a look at it firsthand and we repair it. So the early intervention, we could repair meniscal tears, and the ligament injuries can be repaired, and we can recoup you as soon as possible. So do not neglect any sports injury or a road traffic accident injury wherein you have knee swelling and instability. Reach to your orthopedic doctor as soon as possible, and if necessary, get an MRI scan done. And once you're diagnosed with a ligament or a meniscal injury, get it treated as soon as possible. At Kasturi Hospital, we specialize in the department of arthroscopy. We do all kind of arthroscopic procedures of the knee, shoulder, wrist, elbow, and ankle. But here we're talking about the knee. So we regularly do ACL reconstruction surgeries, PCL, that is a posterior cruciate ligament reconstruction surgeries, meniscal repairs, and repairs of the MCL and the LCL.